Hi everyone, it's Janie. I'm going to be talking about crypt organism and it is undescended or hidden testes. In the early weeks of gestation, the fetus's testes develop in the abdomen. Between 32 and 36 weeks, the testes descend into the scrotum. Crypt organism is a multifactorial condition that can be genetic with environmental influences. The book gives examples like maternal smoking and the use of pesticides while pregnant. The exact cause is unknown. They do know that sperm production is decreased in the undescended testicle or the testicle that didn't descend. Increased risk for cancers, testicular torsion, and inguinal hernias have also been noted. 1% to 5% of healthy boys have at least one undescended testes. Also, premature boys and boys with low birth weight or smaller than average length when born are manifestations. Testes that are not easily palpated at birth, testicles that are not easily guided into the scrotum, or previously descended testes that ascend to the extrascrotal position. This happens between 4 and 10 years old. It is not painful for infants, however, if it happens later on in life, it can be painful. How is crypt organism diagnosed? It is diagnosed by palpation of the scrotal sac at birth. Also, if it cannot be palpated at all or anywhere, there will need to be an exploratory laparoscopic surgery. These are the areas that the testis can be at. Ectopic means that the testis is not in normal route of descent. True means that it follows a normal descent path. Boys with crypt organism are at increased risk for infertility if both testes are undescended, or testicular cancer. Those who have had crypt organism are 2 to 8 times more likely to develop testicular cancer. Testicular cancer makes up 1% of cancers in males and has a 95% survival rate. These are both extremely rare, and baby boys most of the time make a full recovery. This is what a picture of testicular cancer looks like. How is crypt organism corrected? Spontaneous descent of the testes happen by 6 months. This will need to be assessed at every well visit or their surgery. Orchidopexy is an outpatient laparoscopic surgery that needs to be done by 12 months old. What they will do is they will go in and they will cut the binds or the cords that hold the testes in place or where it's not at. They will guide it down to the scrotum and they will suture it in place. This will decrease the chance of cancers and infertility. Or if it is too high in the abdomen and they cannot guide it down, an orchectomy will be performed. This is a total removal of the testis. The most complication of these surgeries are bleeding and infection. However, this is rare. These are 2 orchidopexys. Open is not performed so much anymore. It is done more laparoscopically, like you see on the right here. Also, it can be performed laparoscopically where they go in through the scrotum and pull the testis down. Nursing interventions. Assessment of the scrotal sac with routine physical exam at birth. Assessment of the parent's knowledge of the undescended testes treatment and their knowledge of the importance of treatment. Educating parents about the treatment, which includes talking to the parents about having to make sure they educate their son when he gets older about testicular self-exams and how to properly perform testicular self-exams and what to look for. You're going to provide them with resources. They will need referrals, especially if it's bilateral undescent of testes or absent of testes, to counselors, psychologists, and specialists. If the child has surgery, you will provide routine postoperative care, monitoring voiding patterns, pain levels, and swelling, along with observing signs of bleeding and infection. To evaluate if what we taught the parents is correct, because it is parent-centered at this point in time when they are infants, we will use the teach-back method. Have the parents state and understand the importance of teaching adolescents about regular testicular self-exams and how to seek fertility testing if appropriate. If appropriate is if they have both undescended testes. Collular. Testes can retract into the inguinal canal if the child is upset or cold. Testicular retraction is in response to stimulation of the front inner thigh. This is called the cremasteric reflex and can cause false diagnosis. To assess, have the child in a warm environment, have the child calm. Warm your hands. What you will do is you will milk the testes down from the groin and into the scrotum. You will document the distal point. When examining older children, you will need to do both sitting and frog position. Article 1 is cryptoorganism. It is from the National Center of Biotechnology in the National Library of Medicine from the National Institute of Health. This article talks about the main cause of cryptoorganism being low birth weight, and about 80% of all instances resolves itself by 6 months of age. It also brings up the topic of hormone therapy. Hormone therapy used to be a treatment for cryptoorganism. Evidence shows low response to the therapy. It is, however, recommended for children with Prader-Willi syndrome. It is best practice to avoid anesthesia for these individuals because of their low muscle tone and risk for underlying respiratory compromise. Hormone treatment costs less than surgery, but studies show that it helps no more than a placebo. The best practice for this condition is surgery if the testis does not descend to the scrotal sac by 6 months of age. My second article was the assessment of testicular self-examination, knowledge of health belief model of health sciences students. This article is a study done on a group of college males to ask if they perform testicular self-exams. The study was done by the University of Turkey. Study found that many of the participants knew about testicular cancer, but only 11.1% of the 372 participants performed a TSE regularly. Also, many participants had no real training on how to perform this exam. Why I believe this is important because cryptoorganism puts each male with a disorder at risk for testicular malignancies or infertilities. And it is not just people that have had cryptoorganism to develop testicular cancer. Only 30% of those with testicular cancer have had cryptoorganism. With testicular cancer, early detection is the key to cure it. Growth and development. We'll start with infants. Infants at this stage aren't sure what's going on. They are focused on eating, sleeping, and pooping. There's no pain or fear associated with it. They do not know what is going on. Infants are good sensing mother's feelings. Keeping mother calm keeps baby calm. At this stage, it is usually cryptoorganism is usually discovered. We will also be waiting and seeing if the testes fully descend. Toddlers, they're not scared of much at this age. They focus on play, shapes, and colors. If once descended testes ascends at this stage, it can be painful. Keeping the child calm is easy with treats, coloring books, and toys, sometimes candy. This stage, usually the child has already had surgery and is being watched for any abnormalities. Preschool. Children are able to point where it hurts. They are not able to perform self-exams. They do not understand what may or may not have happened to them. Many, like the toddler stage, can be kept calm with games and toys. Usually at this stage, a child has had surgery and is not aware of it. If the testes ascends at this point, it will be painful as well. Parents are able, with a school-age child, a parent is able to start having open conversations about testicular self-exams at this stage. Children are becoming more aware of the world around them and have fears of their own. It is a little harder to keep the child calm. They are asking many questions and hyper aware of everything that doesn't seem right. The child might be put off at this point. If a parent and doctor are talking about the condition, the child may shy away. adolescence. At this stage, young boys should be able to perform a TSE and notice any bumps or lumps. They have a general idea of what happened and what they need to watch for. If hurt or scared, it is harder to calm them. Educating the child at this point is okay because they do understand most. At this stage, they are becoming more conscious of their bodies. Also, in the adolescent stage, during about 15 to 35 years of age is when most testicular cancers develop. Adult comparison and residual effects. Men that have had cryptoorganism as infants will need to be vigilant in doing regular testicular exams. 30% of males that had cryptoorganism will develop testicular cancer. If they have had both undescended testes, then making sure to follow up with all professionals about their options for becoming a father if they want to become a father, and also hormone therapy if needed. What is the priority nursing intervention for a newborn diagnosed with cryptoorganism? A. Assess the parent's education level and knowledge of the child's condition. B. Administering pain medication to the neonate. C. Educating the parent on the child's condition and providing them with resources. D. Consult with physicians about immediate surgical interventions. The answer is C. The child is a newborn with this condition. The medical intervention is to observe the child for 6 months for spontaneous descent. A nurse is examining a newborn postpartum. During the examination, the nurse knows that the child has an undescended testis. When the physician examines the child, they find both testes in place. What could have happened during the initial exam? A. The testicle spontaneously descended within that time frame. The cremasteric reflex caused a false diagnosis from a child being upset or cold. The nurse did not perform the exam. Or D. None of the above. The answer is B. It is important that the infant is in warm and not too upset. Being cold and upset can cause testicular retraction in response to tactile stimulation to the front inner thigh. And these are my references. Thank you.